How are you? This is Dr. Kamel again, and a new content related to the preparation for physical therapy license exam for people who are interested in taking the NPTE or the National Physical Therapy exam in the United States, or the BCE Physiotherapy Competency exam in Canada, or the Australian exam. If you don't know me, my name is Dr. Kamel. I work as Associate Professor of Physical Therapy in the United States, and I'm a licensed physical therapist in a number of states across United States, also in the UK and in Egypt. I have got my PhD from University of Nottingham in the UK. So let's go to today's content very quickly. A 67-year-old office worker reports long-standing swelling in both legs that becomes worse by the end of the day. It means that this man has been standing for a long time, and by the end of the day, this swelling is increasing. Okay, especially after sitting at his desk for many hours. Okay, so even after sitting for long many hours without movement, without walking, on examination, the therapist observes pitting edema, dilated superficial veins, and an area of skin discoloration around the medial malleus. These signs and symptoms, gear us toward something maybe venous thing. This skin discoloration around the medial malleus, especially the location, maybe venous ulcer, maybe I don't know, dilated superficial veins. This edema after prolonged sitting or standing, we will see. The patient states he recently noticed a small wound above his medial ankle. This is ulcer that has been slow to heal. Based on these findings, which condition is the patient most likely exhibiting? Okay, so this is normal superficial veins, no edema, ulceration, and patches of gangrene around the toes? I don't think so. Dilation of superficial veins, edema, and stasis ulceration might be, because these are close to the description in this clinical vignette. No edema. How come? And we have edema. Faint dorsal pedis pulse means reduced pulsation. And this is usually with arterial insufficiency, not venous insufficiency. And cold, again, this is arterial insufficiency. Hairless extremities because of, low nutrition going distally or to the periphery. So again, this is arterial insufficiency. So this is not the answer. Dilation of superficial veins and edema made worse during sitting or elevation of the lower extremities. I would agree with the first part, which is during sitting, but I would not agree with the second part with elevation, because with elevation, actually, this edema should be reduced and this dilation should be reduced. So let's go and see what is the answer for this question. Number two, it is dilation of superficial veins, edema, and stasis ulceration. These are the classic signs and symptoms of chronic venous insufficiency. In chronic venous insufficiency, we have a blood supply which is going to the periphery, so from proximal to distal, but unfortunately, there is this blood supply is not returning. So there is a decrease in venous return, and this is what we mean by chronic venous insufficiency. What would be the signs and symptoms? Dilated superficial veins and varicocytes, lower extremity edema, which would be worse with prolonged standing or sitting. Okay, skin changes, hemosiderin staining, means because of the stasis of this venous blood, hemoglobin will be broken down, okay, and there will be this hemosiderin staining, which is mainly breakdown of heme, will be like brownish discoloration around the medial malleus. And because of this prolonged status of um, venous stasis, we might have dermatitis. Okay, stasis ulcer, and this patient actually is developing a small ulcer, typically over the medial malleolus, because for arterial insufficiency or arterial ulcer, usually it would be around the lateral malleolus. Okay, so chronic venous insufficiency, usually it is due to venous valve incompetent. This should be a one-way street or one-way direction of blood from periphery back to the heart. Okay, so from distal back to the heart. But if the valve is incompetent, what will happen? When you stand, when you sit for a long time, blood will pools in the legs. This will increase venous pressure, will result in edema, and this edema later on, because of the stasis, will lead to skin breakdown and ulceration. So this is matching, option number two, actually, that this is a venous ulcer and this is chronic venous insufficiency. Let's look at the incorrect options. So number one, saying normal superficial vein, no edema, ulceration, and patches of gangrene. No. Actually, gangrene will be meaning critical limb ischemia, means that, there is severe arterial insufficiency. So the blood is not going to the periphery. And this is not venous insufficiency. Here, there is no edema. Okay. Arterial disease usually have minimal or no edema. Ulceration with gangrene, this will be arterial ulcer with gangrene, this gangrene due to ischemia. Toes and distal digits will be affected for sure, as they are the most distal parts. Okay, so this is not the answer. Number three, no edema, faint pedis, pulse, and cold and hairless extremities. Again, this is arterial insufficiency, not venous. So decrease or absent pulse. We actually trying to palpate the dorsalis pedis and posterior tibial to check the pulse strength and see if there is pulsation or there is no pulsation or reduced pulsation. If there is a cold, pale, or hairless skin, again, this is arterial insufficiency. No edema, pain increased with elevation. This is again arterial insufficiency. Okay. But in venous insufficiency, usually we have normal pulse, we have warm skin, we have significant edema, which is not this description. Number four, dilation of superficial veins and edema made worse during sitting or elevation. As I told you, this is partially correct. I would accept the first part, okay, as in venous insufficiency, this edema will be increasing and dilation of superficial veins with prolonged sitting or standing, but it will improve actually with elevation of the lower extremity. It will not be worse. Okay. So if edema is worse with limb elevation, this means arterial insufficiency. Okay. Because, elevation will make it hard for blood to go more distally. Okay. So, let's summarize. Which is the correct answer? Number two. Why? Because these are the classic signs of chronic venous insufficiency: edema, varicose veins, stasis ulcer around the medial malleolus. Number one is incorrect because this will describe arterial disease with gangrene, which is severe arterial insufficiency. Number three, incorrect. Decreased pulse, cold, hair, skin, arterial insufficiency again. Number four is incorrect. Edema should improve with elevation, not worse. Okay. So as I told you, we need to differentiate between venous and arterial insufficiency, venous ulcer and arterial ulcer. And actually, we spent quite time in our course explaining that in the section of integumentary, where we can differentiate between the different types of ulcers. And we have other types as well. We have also, we have pressure ulcers, We have also neuropathic ulcers. So we have quite number of those ulcers over there. I wish that you have enjoyed my the question for today and my content. If so, please subscribe to the channel and kindly give the link to other physical therapists and to your colleagues. And if you would like to join my BT license preparation course, please send me a message or on WhatsApp number 001442248720 or 00201027743702. If you are a graduate of physical therapy school and you are interested in applying and joining the transitional doctor of physical therapy degree or at University of Montana, which might be we can get you a discounted rate and for this degree. So please again send me a message on this WhatsApp number and I will give you all the details for the required documents and how to apply and how to join. Thank you for watching me and see you soon in a new content.